Abdomen. As always, let's look at some terminology that's specific to the abdomen or the gastrointestinal system. Peristalsis is a wave-like motion, and it is the motion that propels material through that digestive tract. So it starts from the esophagus, goes down to the stomach. We see the peristaltic action also in the small intestine and the lower intestine. Constipation, these are infrequent stools that are dry, hard, and or difficult to pass, or an absence of bowel movements. Constipation is not necessarily based on the number of days, it's based on the characteristics of the stool. So once again, they would be infrequent, dry, hard, and or difficult to pass. On the flip side, we have diarrhea. Diarrhea is not necessarily the frequency of the stool so much as the characteristic. However, it will be frequent and watery. Distension, the abdomen may be filled with gas, feces, a tumor, fluid, whatever reason it's causing an enlargement of the abdomen. Ascites is a fluid-filled abdomen. Usually, this fluid is going to be very high in protein. Flatus is gas that's passed through the anus. A mnemonic that's going to help us remember what questions to ask when it comes to talking about different issues going on with the gastrointestinal system is old carts. This consists of the onset, the location, the duration, the characteristics, aggravating or alleviating factors, relieving factors, treatment, and severity. So as we go into the interview with the gastrointestinal system, we're asking if the client has any pain. If they have pain, where is it at? What is its character? Is it crampy? Is it sharp? Is it burning, stinging, etc.? Is there anything that alters the intensity of the pain? Does the pain stay in one place or does it move around? And is there anything in specific that triggers the pain? Have they had any changes in their bowel habits? Do they have heartburn? If so, how often? And is there anything in specific that triggers it? Have they had a change in their appetite recently? Do they have a history of gastrointestinal disease? Do they have excessive gas, whether it's belching or flatus? Do they take any medications? What medications do they take? For example, we know that opioids can cause constipation. We know that laxatives or suppositories can lead to dependence in order for the client to have a bowel movement. And do they have a family history of any gastrointestinal issues? So when we're assessing the gastrointestinal system, we divide the abdomen into 4 different quadrants. We're going to have the client in a supine position with the knees slightly bent. This is going to decrease tension on the abdomen. Excuse me. We auscultate vowel sounds in all 4 quadrants. For it to be considered normal bowel sounds, we have 5 to 30 sounds per minute. If there's less than 5, that's hypoactive. If there are more than 30, that is hyperactive. And of course, we also have absent. So to determine your quadrants, we draw an imaginary line straight up and down and straight across from the umbilicus. So how do we actually assess the abdomen? First of all, we're going to inspect it. We need to inspect it at the client's side and standing at their feet. We're looking at the contour, the size. Is it symmetrical? In other words, is it the same everywhere? What is the condition of the skin? What color is it? Are there any lesions, veins? Do you see any hernias? Hernias are going to be kind of a soft bulge uh, somewhere in the abdomen, often seen around the umbilicus or around a scar or potentially lower in the groin area. Then we're going to auscultate. Again, warm the stethoscope between your hands and place the diaphragm of the stethoscope on the abdomen, starting at the right lower quadrant. You're listening for the intensity, the pitch, and the frequency of the bowel sounds. If we have the normal sounds that we're going to hear are going to be loud gurgling sounds as the gas or feces moves through the intestines. If it's hyperactive, these are really loud, high-pitched sounds. Hypoactive are slow, decreased sounds. The third thing we'll do is palpate, and you need to do it in this order. So always inspect first, auscultate second, palpate third. Again, warm your hands by rubbing them together. If your client is ticklish, it's difficult to do a palpation, so make sure that you ask them to put their hand on top of yours. Sometimes that helps decrease that tickle sensation. If they have an area of their abdomen that is tender, that should always be palpated last. So, for example, the right lower quadrant is tender. We would palpate that area very last. We go in a clockwise motion, so a clockwise rotation. We start in one quadrant and then we move to clockwise to the next, and we keep going till we've palpated all quadrants. So we use the finger pads of one hand and we press down about 1/2 inch. You don't need to go any further than that, but you're not going to just palpate one area in each quadrant. You're going to do 2 or 3 areas in each quadrant, kind of moving those fingers lightly. Lift your fingers gently as you move to another area, and make sure that you're watching the client's facial expression for signs of pain, because sometimes they will tell you one thing, but their body language tells you something completely different. This is a diagram to show you the different contours of the abdomen that you may see. So you've got the flat, scaphoid, rounded, and protuberant.